Hello, my name is Stephanie Carol Newell, and today I'll be teaching you about literacy in healthcare. I think that literacy in healthcare is not often discussed or talked about or, really thought about in healthcare, but it's a very important thing that we need to discuss. Whether or not a person is able to read or understand what you are saying is so important in healthcare. And as healthcare professionals, as future healthcare professionals, I really want you to be well educated about this topic. I won't take too much of your time, but I really want you to grab hold of this and take it to your profession, whether you work in it now or later. Yes, so let's talk about literacy in healthcare. Here are some goals of the teaching video. Today we are going to define the terms literacy, illiteracy, health literacy, low literacy, functional literacy, reading, reading ability, comprehension, and numeracy. We're also going to identify the magnitude of the literacy problem in the United States. We're going to describe the characteristics of those individuals at risk for having difficulty with reading and comprehension of written and oral languages. We're going to discuss common myths and assumptions about people with illiteracy. We're going to discuss clues that are indicators of reading and writing deficiencies. We're going to assess the impact of illiteracy and low literacy on client motivation and compliance with health skills. And we're going to use specific formulas and tests to critically analyze the readability and comprehension levels of a printed material and the reading skills of clients. Sound interesting? I hope so. We're also going to describe specific guidelines for writing effective education materials, outline various teaching strategies useful in educating clients with low literacy skills, and recognize the research and policy-making issues that must be addressed to solve the health literacy problem. Objectives of the content. The objectives of the content is to educate health education students of the fact that there are people who are illiterate and that their illiteracy affects their ability to receive quality health care and understand when communicating with healthcare personnel. So here we're just trying to understand how illiteracy affects our jobs as healthcare professionals, you as future or current healthcare professionals, and how you could take this on your job or your future job. Okay, here I would like you to take note of the definitions and terms that we are going to be going over. The first one is literate, L-I-T-E-R-A-T-E. Very important. The definition of literate is the ability to write and to read, understand and interpret information written at the 8th grade level or above. Take big notice of that. So if you are literate, you are able to read at the 8th grade level or above. If you are not literate, you read at below the 8th grade level. So if someone tells you that they only went as high as the 2nd grade, 3rd grade, 4th grade, they are telling you that they are illiterate. But if someone tells you they graduated high school, they are literate, or should be literate. Let me point that out. They should be literate. Not everyone who graduates is literate, but they should be. There are holes in the education system as well as the healthcare system. Okay, illiterate is defined as someone who is unable to read or write at all, or whose reading and writing skills are at the 4th grade level or below. Low literacy, also termed marginally literate or marginally illiterate, refers to the ability of adults' ability to read, write, and comprehend information between the 5th and 8th grade levels of difficulty. Functional illiteracy means that adults lack the fundamental reading, writing, and comprehension skills that are needed to operate effectively in today's society. That goes back to what I was just saying. There are a lot of people who are not inherently literate, excuse me, that are not inherently literate, but they are functioning. They're able to get a job. They're able to have a family, even able to hold a job, and basically be an adult, pay bills, do all that, but they're actually illiterate. Health literacy refers to how well an individual can read, interpret, and comprehend health information for maintaining an optimal level of wellness. This is a person who goes to the doctor and is able to take in what the doctor is saying, and when they give you the health information about any new diagnosis that you may have, or even a current diagnosis you have, they're able to comprehend what it's talking about, and comprehend what the doctor or nurse is telling them about their condition. Reading, or word recognition, as the process of transforming letters into words and being able to pronounce them correctly. Readability is defined as the ease with which written or printed information can be read. Comprehension, the degree to which individuals understand what they have read. And numeracy, the ability to read and interpret numbers. Okay, do I have any questions about any of these definitions? No? Okay. So now we're going to talk about some percentages in literacy and get a general understanding. 52% of the U.S. population is considered literate. 52%. 26% of the population is considered marginally literate. And 21 to 23% of the U.S. population is considered functionally illiterate. So there's a big percentage of the country that is considered illiterate, which is a rather epidemic. Now here are some reasons for illiteracy. 1, a rise in the number of immigrants, the aging of the population, the increased amount and complexity of information, more people living in poverty, changes in policies and funding for public education, and disparities between minorities versus non-minority populations. Those at risk. those who are economically disadvantaged, older adults, immigrants, particularly illegal ones, racial minorities, high school dropouts, those who are unemployed, prisoners, inner city and rural residents, and those with poor health status resulting from chronic mental and physical problems. Clues to look for. Never just assume that someone is literate. Never. Noticing poor reading abilities, reacting to complex learning situations by withdrawal, complete avoidance, or being repeatedly non-compliant, using the excuse that they were too busy, too tired, too sick, too sedated with medication to maintain their attention span when given a booklet or instruction sheet to read, claiming that they just did not feel like reading, they gave the information to their spouse to take home, or they lost, forgot, or broke their glasses. Camouflaging their problem by surrounding themselves with books, magazines, and newspapers to give the impression that they are able to read. Circumventing their ability by insisting on taking the information home to read, or having a family member or friend with them when the written information is presented. Asking you to read the information for them under the guise that their eyes are bothersome, they lack interest, or they do not have the energy to devote to the task of learning. Showing nervousness as a result of of feeling stressed by the threat of the by the threat of the possibility of getting caught or having to confess illiteracy. Acting confused, talking out of context, holding reading materials upside down, or expressing thoughts that may seem totally irrelevant to the topic of conversation. And I'm just going to let you continue reading the slides. And while you're reading, I just want to mention that I would like to talk about the reading assignment. We are in Chapter 7, Literacy in the Adult Client Population. I would hope that you would read page 230 through 245. That's the reading for tonight. And the homework is on the last page, the questionnaire. Just complete all those questions, all 10 of them. Very important. Okay, and I'll just read this last page. The impact on compliance and motivation. Okay, if a patient is not compliant, it cannot read and cannot understand literature or even what the medical personnel is trying to tell them. It has a profound effect on their ability to be compliant and their motivation for care. It's hard to be motivated for care when you can't read material that is given to you by the medical personnel. And it's hard to be compliant if you don't understand what to be compliant to. Do you all understand what I'm trying to tell you? You have to understand what you need to be compliant to in order to be motivated. So what can we do? We can be compassionate, we can be open and receptive, and we can offer our own abilities by helping them and reading their material to them, being kind to them when they say they are illiterate. The worst thing you can do is be disrespectful. And we can be professional. It's always very important to be professional in this field. Okay, so now we're going to have a discussion. So if you will, get in groups of 3. We're all going to discuss how literacy or illiteracy has had an effect on our lives, and what would you do if you came across a patient, or what have you done if you have already done so? If you come across or have come across a patient who is illiterate. Thank you.